This is Erica Grotto. I am here at HFMA's annual conference in Nashville. I'm so pleased to be joined today by Navneet Nair from INFINX. Welcome.
Thank you, Erica.
So we've talked about AI a little bit before. In your experience, how are hospitals leveraging AI to improve patient access and the revenue cycle?
We are seeing AI become the prevalent topic over the last few years. I've been solving AI-related problems for the last 10 years in healthcare, but what I see in the last few years, I think the energy has really increased with respect to AI, especially in the provider space. What I've seen with providers are they're very outcome-focused, and when you have innovation that immediately is not reflective of outcomes, there is not adoption, but in the last few years, we are starting to see that adoption. Some of the big areas that we see, particularly in the front end pre-visit in the patient access arena, is primarily around being able to identify the payment that needs to be made pre-visit, predicting whether the person has the propensity to pay, and doing the financial engagement, because most providers have realized at this point that you actually need to collect at point of service, and that's become really an important part of the financial kind of management of a healthcare provider, which has changed quite a bit. And AI really is good at using all the data that is available to actually make those predictions. Then as you think through the rest of the revenue cycle, everything from identifying which payers are looking for prior authorization, that's one area that providers are starting to look at and say, can I identify that upfront from a prior authorization perspective? And then in revenue cycle, whether that is coding, denial prevention, or denial management, there are multiple use cases where revenue can be predicted based on using AI. One of the things providers have started to recognize is that they have a lot of data. They just have not been able to apply it, and now AI allows them to apply it to be intelligent within their business.
So let's talk about predictive analytics. How does AI assist with predictive analytics? And can you give some examples of how that might work?
Yeah. One of the areas predictive analytics is very powerful is in denial prediction. I think I was hearing one of the panels speak yesterday, and I was blown away to hear that the denials have increased 30 to 40% in the last 2 years from the payers. So talk about increased workloads. And denial predictions, actually, what that means is there's more data. So you can actually learn from the data. In the past, you would actually have large analytics teams create spreadsheets and pivot and figure out which payer, what kind of denial types. AI is really good at learning from data at scale. So you can actually apply AI for something like that. The next is, I think, recovery, right? AR recovery is one area where we have done a lot of work, where we have seen providers get value, because once you have a lot of outstanding AR, which ones to go after? And we were having this conversation yesterday, and I was listening to the panel where they were saying, oh, we just did a pivot based on high dollar value. And I was sitting there saying, wait, this is where AI needs to come into play, and you have absolute ability to apply that from a recovery perspective. I think CFOs are starting to use that predictive forecasting, whether it's for reserve management or understanding bad debt and write-offs. CFOs have now more powerful tools than actually doing historical analysis. They can predict what their outcomes in future revenues might look like. So those are some of the use cases around AI, but I think we're just scratching the surface. I think the entire revenue cycle has potential for application from an AI perspective across various use cases.
I'm really interested to see what is next, what comes next, and how that can help healthcare organizations as they continue to try to meet these challenges. But thank you so much for joining me today.
I appreciate your time, Erica. Thank you so much.